We are going to start today's meeting, July 14th, with our study session, and I will hand it to the clerk to do roll call.
Supervisor Connell.
Present.
Supervisor Christie.
Here.
Supervisor Hines. Supervisor Scott.
Here.
Chair Allen.
Here.
Let the record show Supervisor Christie is participating remotely. Supervisor Hines is not present. All other board members are present.
Any agenda adjustments? That would be item 2 on the study session agenda.
Chair Allen, I do not have any agenda adjustments, but I believe Mr. Brown has one.
Yeah, Chair Allen, addendum item 3. My apologies. Addendum item 2. We'd like to strike the word investigation and replace it with the word inquiry for addendum item 2, just for the record.
Thank you.
Thank you.
We are going to move up the addendum items. There are 3 addenda items that are executive session items, and address those first. And my estimation is that we will be in executive session for 1 hour. There's 3 items. We're aiming for 20 minutes per item, 20, 40, 60. Yep, good math. I did not apply for the treasurer position. We need to vote. So all those in favor of breaking for executive session? Oh, I'll make a motion to break for executive session.
Second.
Seconded by Supervisor Scott. Discussion? All those in favor?
Aye.
Aye. Opposed? Okay. Item passes 4-0, and we will break for executive session and expect to be back in an hour.
Test, test.
We're sending it out to Knox. It comes in a car? No. If it's going to Knox, it has to be going to you. And it is. And that means it has to be going to Granicus. And it is. I see all this stuff. Are you sure Granicus? I don't know why he's speaking over here. Oh. I thought you said. Can you turn it up more? I mean, it's almost like they're already loud. I don't understand why that's like. He could just point it out. He's like, you're live. Just like the case. I don't know if the sound's coming out or like doing whatever, but I just wanted to point out what it was that he said.
Test, test, 1, 2, 3. Test, test.
All right, we are back from executive session. For the three addendum items that were discussed in executive session, I'll say item number one was for informational purposes only. Addendum item two was also informational purposes only, as was three, informational purposes only. We are now to study session, agenda item number three. This was unfinished business, staffing process, and vacancy policy. I would Supervisor Scott?
Chair Allen, I'd like to request that we continue this item to the August study session, and would also like to request that if we schedule a retreat right around the time of the beginning of the new budgetary process, that we include this item on that retreat. And then preparing for the August study session, which I anticipate will just be a preliminary discussion of what will likely be a multi-stage conversation, I would just ask that a staff prepare slides that address both the vacancy policy and the staffing questions that were listed.
I will second. Seconded by Supervisor Allen. Further discussion? All those in favor?
Aye.
Those opposed? The item is continued to the August study session. And I believe that was a 5-0 vote. I'm sorry, Supervisor Christie, I did not look up to catch your thumbs up. Was that excellent? Okay, 5-0. I also meant to note that we are time bound for this study session, and we need to wrap up by 4:30 at the absolute latest. So the agenda committee ascribes some times for each agenda item. So at the beginning of those agenda items, I will note how much time we thought would be appropriate for that discussion, which does not mean that we're just going to close off, hit the gong, and drag people off. But we just need to be mindful of the allocations of time so that we don't run over. And we'll have to continue to adjust as we move along. So that said, agenda item number 4, this is representative updates on boards, committees, commissions. We said 3 minutes for this item, so clearly we are expecting this to be quick. Anyone have any updates to share?
Chair Allen.
Supervisor Scott.
There was a Board of Directors meeting for the Chamber of Southern Arizona just yesterday. And the board received some updates on Project SWIFT from a guest of the chamber. I can't go much beyond what Project SWIFT is, but I think it's something that most of my colleagues are aware of. And there was that discussion, and there was also a discussion on the Regional Economic Growth Initiative, which I think Mr. Snell and Ms. Dumont have talked with individual supervisors about.
I will note, so I represent the board on 2 bodies. One is the Arizona Border Counties Coalition, which did not meet since the last time we had this item. But I also represent the board on the Southern Arizona Education Council. There was a meeting today. It's the first meeting that I've participated in. We discussed, and I should note, my office represented me since it was today. We discussed and approved the fiscal year 26-27 budget. There was a program report highlighting events that were coming up this year. A resolution was passed to remove Santa Cruz County from the formal governance and membership structure of the council, and a resolution of the council in opposition to 2026 legislative ballot referrals affecting the educational welfare and well-being of learners, educators, and institutions that serve them, I believe was voted on and approved. And it was technically a meeting of the executive council, or the executive committee of which I'm not on, so we were able to observe. But that's my updates. Anything else? Okay. Then we are going to move on to item number 5. This is the Plaza Mobile Market presentation. And I believe we have some guests. we've got Jen Parlin and Meredith Glaubach. And I will note, so we allocated 15 minutes for this item with the expectation of a presentation of hopefully less than 10, so that that's half discussion, half presentation. So please go ahead.
Okay. Good afternoon. My name is Meredith Glaubach. I'm the local foods coordinator for the Garden Kitchen. And I'm joined by Jen Parlin, who's the interim director for the Pima County Cooperative Extension. We also have our partners here from the International Rescue Committee and the Valencia Library. And next slide, please. So some somber realities to ground us in before we start. As we know, Arizona leads the country in kicking folks off of SNAP this year. At least 400,000 people have lost this critical benefit. We also know that a lot of Arizonans struggle with diet-related diseases, and access to fresh fruits and vegetables can help those dietary habits, which we know impacts those diet-related diseases. Next slide, please. So it's with this information that we have developed Plaza Mobile Market. That stands for Promoting Local Arizona Agriculture Mobile Market. This market has been in effect for over 2.5 years now, and we marry both food access as well as support for farmers. And so we buy directly from small, marginalized farmers, most of whom are in Pima County, many of whom are refugees. And we buy at prices that they help set. So we're doing fair market pricing for them. We aggregate that produce with goods from other local businesses and specialty crops. And then we bring that to low-income communities where we sell that produce for about half a fair market price. And we also offer nutrition assistance benefits. And this market serves as a social and cultural hub. So people come together, they connect over produce, and they connect over culturally relevant items. Next slide, please. So we spent about 2 years researching this program. We did deep community engagement. We've done focus groups and interviews with both low-income individuals and farmers. And through that process, we have placed the markets at locations where people are already locating. So for us, that's been the library system. We have reduced prices because we know that folks need affordable food. And so we both do that reduced price as well as government assistance benefits. And we also heard from folks that they didn't feel like they belonged at traditional farmers markets. And so we have made sure to have bilingual staff. We've really built vulnerable relationships with our customers, and people, without us prompting, have told us they feel like they belong. They feel like that they're home at the market. Next slide, please. The program is deeply aligned with the Prosperity Initiative. It is doing neighborhood improvement, by creating an environment where folks can come together. It is positive. It is a third space for folks to gather. And they not only can access this beautiful produce, but they also can connect with one another. We are doing small business development through our work with small farmers. And so we help with things like crop planning. We give harvest recommendations, and we do other technical assistance. We're also decreasing household expenses by that reduced cost of our produce and by providing a plethora of government assistance benefits. Next slide, please. We already work deeply with Pima County. So as mentioned, we locate both of our markets at Pima County Public Library, that Valencia Library, as well as the Quincy Douglas Library. And we have Pima County Health Department community health workers come to the market so they can offer wraparound services in addition to the food security support that we help with. And we also work directly with the REACH department of the Pima County Health Department. Next slide, please. The impacts of this program are too vast to put on one slide, but some highlights is that we have sold about 15,000 pounds of produce through the duration of this program, most of which, 15,000 pounds of food, most of which is produce. We have served 40% of shoppers who are using nutrition assistance benefits. A major benefit is FMNP, and through our partnership with the library, we have made sure that folks have access to $30,000 of free vouchers for fruits and vegetables, and that particularly goes to WIC families as well as low-income seniors. We have served 4,200 visits, many of which are from children, and so we're making sure that folks know where their food is coming from. And something I'm really proud of is in November of 25, when we knew that SNAP benefits were at such risk for folks, we were able to step up and really immediately change our model. And so we started sourcing from northern Arizona farmers. We sourced protein for the very first time. And that month, we were able to over triple the amount of food that we were getting to folks as compared to the month before. That month, 80% of our sales were from nutrition assistance benefits. So we know it is likely that we will have other health and climate crises, and it is critical that we have programs that can respond to that moment.
Next slide, please. Plaza Mobile Market was originally funded by SNAP Education Grant through the federal government, but that program was defunded with the passage of HR 1. After that, we were competitively selected by Arizona Department of Health Services to continue with carry forward funding until August 30th of this year. After that, we had been included in the racial and ethnic approaches to community health grant application with the Pima County Health Department, but because of federal changes that look very likely, this is also at risk. We have been recommended for outside agency for the first year this year, and we have received CDBG funding, but those are both in limited basis. Next slide, please. We're here seeking bridge funding from the county to support the program until other potential funding sources reopen. And we have 3 investment scenarios for you to consider. Next slide. The sustained investment scenario protects programmatic infrastructure created over the last 4 years, retains the markets in districts 2 and 5, and retains technical assistance for small farmers and our leadership work with the Pima County Food Alliance, while also supporting the development of a diverse funding strategy. Next slide. The expand investment scenario increases Plaza Mobile Market from 2 to 4 markets weekly by adding 1 market in District 3, 1 market in District 5, and rural pop-up markets. County support expands access to affordable, nutritious food while providing the foundation for long-term program sustainability. This investment provides approximately 8,000 additional pounds of produce to new areas of the county and is projected to serve about 2,200 additional duplicated constituents per year. Next slide. The last investment scenario transforms Plaza Mobile Market into a county-wide food system initiative serving all 5 Pima County districts, including 1 market in every district and 2 in District 5 for a total of 6 markets weekly. It also establishes a produce prescription program connecting eligible patients with affordable local produce, a value-added foods program providing commercial kitchen access and technical assistance to small farmers and small food entrepreneurs in the county, and the implementation of the Nourish and Grow nutrition education and community leadership model. Next slide. We'd be happy to provide any additional information that you may need or answer any questions you may have. We also have our partners here in order to answer any questions that you may have.
Madam Chair?
Supervisor Christie.
Yes, you mentioned in your presentation that you have or are working on a diverse funding strategy. How much of the contribution to your efforts is being provided by the City of Tucson, and how much?
Supervisor Christie, we are currently not receiving any funding from the city of Tucson.
And that is because,
And that is because when we had gone through the defunding and then the carryover funding, we did not apply for the CDBG through the city of Tucson, but certainly that will be part of our diversification in the future.
thank you.
Supervisor Hines.
Well, first of all, I really appreciate you coming here and presenting this to us. I was very impressed when I visited, actually technically District 5. Wait, no, I was in District, yeah, I was in District 5. Right, so it was really great to meet some of your customers and some of the farmers who were there. It was a great experience. And this is the kind of thing that, that really concerns me. So much like thought and innovation, creativity went into making this happen. We have to all be thinking about a time when there will not be a Trump administration and there will not be the effects of HR1. And we have to, I believe we have a role to protect the things like this that are, you know, we have University of Arizona involved, we've got the library system involved, you've got the Pima County Health Department involved, and you are in fact recommended for funding that we just think the feds are going to probably pull out from under us. So these are the kinds of things that I think are so important for us to know about and that do warrant our consideration for that type of bridge funding, because it's not a forever grant. It's like get us to 2027 or 8, whatever, right? So I really appreciate you what you do every day, and thank you again for being here. And if my colleagues have any questions, of course, I invite them to step up.
Any colleagues have questions? I am curious, and I'm not going to get this what the acronym means, but have you applied to our sticker sort of emergency grants that the county's rolled out? I think we've had 2 rounds, and then a third should be coming out in the next, I think we sort of loosely said in the fall, if I remember right. Have you applied for those in the past?
Supervisor Allen, we have not applied for those, really only because we were in for this REACH funding and we didn't want to take away from anyone else. I know it's a limited pot and there's a lot of need. And so we were going to be fully funded for our staff through this other federal opportunity. And so we didn't apply for it. We've certainly reached out to the managers of that grant now to get in touch with them to make sure that we qualify, because we are not emergency foods. People do pay for the foods, even though it's at a reduced cost. So we're waiting on answers back from them to make sure that we will qualify for that funding, and then we will certainly apply for it.
Thank you. All right. Well, Supervisor Connell?
Thank you, Chair Allen. Much appreciation for all of the incredible work you're doing to keep families in Pima County fed. I look forward to additional partnerships with the county at a later time. As I mentioned, I am paying close attention to what kind of diversified funding streams we can ask anybody requesting county taxpayer dollars to be able to leverage with public-private partnerships. And so, and the direction that I believe I provided from District 5 at our last meeting with the short-term emergency crisis grants is that I'm going to be really open to providing some support closer to the October-November timeframe, because that's when the full effects of HR1 will start to be implemented. I recognize that the challenge with that timeframe is that that's kind of when you are about to not be able to keep services going throughout Pima County. So I'm open, paying close attention to how we can diversify funding sources as well, and also respond to the crisis before us, which is, from what I remember at this last study session, 60,000 kids no longer with access to nutrition as a result of some of these changes. That's not adults, that's just kids. So the work that you do is critical, and I appreciate the information today.
Thank you. Well, thank you. Appreciate the presentation and for being here.
Thank you so much.
The next item is item 6. This is also unfinished business from previous month. This is an update on the Pima County Climate Action Plan.
Thank you, Chair Allen, and we do have Sarah Davis with us today, who's coming up to the table to walk through an update on the plan. Thank you. Anyway.
And I'll note that we allocated 20 minutes for this, so thinking 10 minutes presentation, 10 minutes discussion.
Madam Chair, members of the board, Administrator Lasher, thank you very much for having me here today to discuss a couple of items on one of our summer climate action plan updates for Pima Climate Action now. So as the slides are getting up, we will move to the first slide, please. So several memos underpin the detail of the work completed by the climate action working groups for purposes of this update. Specifically, today's presentation will center on the Water Working Group, which is an interdisciplinary working group within the Climate Action Team, facilitated by Pima County Regional Flood Control District, but also with our Regional Wastewater and Reclamation Department, Facilities Management Department, Project Design and Construction, Department of Environmental Quality, Development Services, Conservation Land Resources, and Parks and Recreation. And the work underpinned by that department really oversees the county's efforts on water supply enhancement, demand management, enhancement of sustainable use of effluent, and innovative strategies to connect our water and landscape strategies, such as green stormwater park infrastructure. The presentation will also center on an update regarding the county's heat policies as requested in the May 12th Board of Supervisors study session, specifically our administrative procedure and our heat ordinance for our contracted workforce heat safety policies. So, and then we'll go into a high-level brief on our August discussion items with the County Board of Supervisors and our regional activities. Next slide, please. So first and foremost, we'll talk about the activities under the Water Working Group, specifically around enhancing water supply, demand management, and kind of future innovative strategies with effluent. I really want to underscore the work done by Regional Flood Control District in this area with enhancing water supply, specifically with green stormwater park infrastructure. The Flood Control District now has completed 7 stormwater parks, the most recent in District 2 with the Julia Keene opening of the stormwater park on May 12th. Some of the pictures here show the development of that park and how some of the stormwater infrastructure has been built, completed. I want to really talk about the incredible portfolio of the stormwater park sites and choosing and designing each site using several data and geospatial strategies, including flooding conditions, heat vulnerability, heat indices and heat islands, tree canopy, and census tract data, specifically social vulnerability indicators, alongside substantial community involvement and neighborhood involvement in the development of these parks. It really is impressive what that team does. And I am neither an engineer nor an architect, so I am probably not doing them justice, but provided in that memo is really some of the innovative work that has been done to design each of these stormwater parks listed here, specifically Seneca, Ritchie, Cherry Avenue, Las Vistas, Elvira, Peter Howell, and now Julia Keene. 2 parks that are active and in development are the Waukee Park, which is in partnership with the Tohono O'odham, and the Amphi Stormwater Park, which I believe is in District 3, which is in development and in the community engagement phase. Additionally, I want to underscore that the U of A partnered with our Regional Flood Control District team to do a stormwater park evaluation, determining that these are not only effective at stormwater capture, but reducing potable water use and developing natural vegetation and enhancing our landscape strategies through tree canopy and other native vegetation items. The other report that will be available on the Pima Climate Action Now website is the detention basin work on the Rita Ranch Detention Basin. The pilot was brought to the board in a previous update last year, and in the first year of data collected from the Rita Ranch Master Plan community, that site captured 23.3 acre feet of stormwater, which is substantial. And so we'll continue to bring updates on the detention basin work in addition to the stormwater park enhancements for groundwater stormwater use. Next slide, please. The next thing we'll talk about is demand and effluent. So I'll start with the not great news first. So while we've seen enhancements over our county demand of water use in our managed facilities, such as the downtown footprint, enhancements to air chillers and improvements to fixtures and equipment across our county buildings, our overall water use was up in the county by 22%. That is in part due to 2 leaks in outside of actively managed facility environments. But I want to underscore what we've learned from this. And I think data is always good, and how do we do better? And so how are we looking at data on our water use management, smart metering on sites that are not actively managed, such as our outside conservation lands, our increased use of parks, but how are we also incorporating data about longer, hotter summers, enhanced use on air chillers? How are we activating recreation spaces and increased fields and water use on that? And how are we promoting effluent to those priority areas as we look at the increased water use over the total county portfolio? So that being said, there is also a lot of really good news to say here. I want to highlight the pictures here, which is the Keno Stadium District and Sports Complex, which has completed its water optimization project, which now uses a combination of effluent and stormwater to put water on all of its site. And that has the anticipated savings of the equivalent of 30 acre feet of potable water, which is 90 households. We also have effluent at Arthur Pack, and all of our libraries are using artificial turf, xeriscaping, and water containment for desert vegetation. Next slide, please. So looking forward, there's a series of things that the Water Working Group is really engaged in, and part of that is the board directive for economic development and water use on economic development projects, and other opportunities for large water uses and where we can strategically use effluents, such as recreation, golf courses, those sorts of components. We're also really monitoring the front runoff recharge projects and doing green stormwater quantification projects. And I want to underscore that all of these priorities are in alignment with the floodplain management plan, Pima Prospers Water chapter, and how we align data across these chapters for priority areas. Next slide, please. So next we'll talk about heat and workforce, and this is a timeline that is very robust, but I wanted to just get us back to 2024 when this all got started. And the board directed the exploration of a heat policy and a heat ordinance. And so that came to fruition through a resolution and substantial public input gathering across not only county operations, but the community. This included feedback gathering from focus groups with labor unions, the business community, the county staff, and resulted in the development of 2 major policies for county operations, heat safety and our workforce ordinance, which was passed in August of 2024. One notable thing, when we circulated the policy for board consideration, we did a public comment period, and our attorney general also provided public input on the county's ordinance. The county is the first county to do a local ordinance, and we worked hand in hand with our City of Phoenix partners and City of Tucson so that all of these ordinances were in alignment with each other, because that was some substantial feedback that we got from the community. Next slide, please. The second year, and I'll remind everybody that part of the reason that local jurisdictions took this on was there was an absence of standardized heat safety policies from a national level and a state level. So year 1 of these heat ordinances and local policies in 2025, the state started directing some interdisciplinary action to explore a statewide heat policy. City of Tucson and Pima County continue to explore options to evaluate and bolster our local policies. I will tell the board that we not only have substantial training plans, the county has deployed a website for businesses, whether they're contracted with us or not, to develop their own heat safety policies. And we have 1,700 contracts issued and no third-party complaints about heat safety policies. What we're thinking in a forward looking way, since the state nor the national policies have been developed, is how do we continue to work really closely with the Industrial Commission and the Arizona Department of Occupational Safety and Health to look at violations, heat safety opportunities. I will say a lot of our contractors are incredibly proactive in working with us, and we've had businesses in the community that are not contracted with us who have reached out on how to develop heat safety plans. Next slide, please. For waste and materials, I'll just give a big shout out to a bunch of teams that put together a surplus pop-up event, which donated over 2,000 pounds of office supplies that were otherwise headed to the landfill, valued at an estimated $25,000 to be redistributed across the county operations. And I think that that's just really like through the excitement of not only the green stewards, but county departments and really managing our own waste and materials. This was an organic event that was facilitated by Department of Environmental Quality, Facilities Management, and Project Design and Construction. Huge success, really cool project. Next slide. So that's it for this update. I will say the August Board of Supervisors study session will be talking about landscapes and our 10,000 tree planting strategy, our invasive species administrative procedure and connection to the wildfire mitigation plan, and we will update the board on the Tucson Electric Power Integrated Resource Plan and the impact on our energy assessment going forward. And there are ways to get involved through the Green Stewards. So with further ado, I will pivot to questions. Thank you.
Supervisor Hines.
Thank you. I was actually at the opening for the Julia Keene Stormwater Park. It just completely just redid the neighborhood. I mean, they were so thrilled. It was really a fantastic project. So I'm glad you mentioned that. Also on the water use situation, how much of that 22% increase that you cited do you think can be attributed to the two leaks outside of, like those two outside leaks? I'm just curious, like how big of a problem is this?
Chair Allen, Supervisor Hines, members of the board, I will get further detail on that. We know the majority was attributed to two major leaks on property that's not actively looked at, but we're looking at smart metering for some of those sites that aren't actively managed, like the downtown portfolio, for example. So I will come back to the board and get an answer to that in terms of what proportion. We also do know that some proportion was an activation of additional recreation spaces and longer, hotter summers. So I'll work with our teams to get an answer to that.
Thank you. I'm just trying to make sure if we should be freaking out or just pausing and figuring out how much of that is really an increase or just kind of a little bit of a confusion. Yeah, thanks.
As a follow-up to that, can you quantify what that is, what the 22% the leak was in terms of gallons or acre feet?
Chair Allen, it was roughly about 148,000 kilogallons. So I can convert that to acre feet. But the leaks have been addressed. So if that is a point of consolation, when we know better, we do better, and there's ways that we can implement metering into this. I think it was a good opportunity for us all to.
Right. And then I think I also saw there was a memo that came in recently about facilities, and and I'm blanking on the number, but just to not end on a sour note around the leakage, but can you remind us of what the savings was? It was energy reduction?
Yes, Chair Allen, members of the board, there was substantial savings. Not only the memo underscored the return on investment of a few $1 million projected with our solar investments and our enhancements to the water use. Because I want to clarify, while overall county operations was up, our managed facilities was down 15%. And so enhancements to the way we cool, the way that we have fixtures and equipment across our county properties, that has all seen a dramatic improvement.
Thank you. I have a couple of other questions around the heat ordinance. Do we have a sense of how many contracts? I understand that there are now 1,700 contracts, right, that are part of our Heat Safety Act. Do you have a sense, are there contracts that don't have the heat safety requirements as part of them? Or have they all been brought in?
Chair Allen, members of the board, we'll have to get back to you on that because of the timeline of when it was implemented at that September implementation period. Contracts and amendments from that point included the heat safety clause. So I'll have to look with our procurement department to see how many were already implemented before we will provide that information back.
And I guess just preemptively, if that number, if it includes contracts where employees are working outdoors and exposed to heat, I guess my request is, can we work to bring them in and do an amendment to those contracts so that it is, explicit, the expectation and the protections for workers? I would also just like to understand a little bit more about I've noted, right, that there's been no third-party complaints. And we can take that in two different ways. One is, oh, great, everybody's in compliance. Our materials are just doing what they should do. Yeah, we could just go with that. Or there's the other path, and it's probably a mix of the two, that people aren't filing complaints. And I guess I'm curious if there are things that we have thought about or done or could do that might encourage complaint filing. And if we have contemplated or maybe already done an education campaign about filing complaints. And that, in fact, filing a complaint is what makes us stronger, and it makes workplaces safer, or whatever the message is. But I'm just curious about what has been done to date to try to encourage if any complaints to be filed.
Chair Allen, members of the board, one component of the heat safety plan and the language of the ordinance does underscore how to create a heat safety plan, and included in that is a bullet on who and how to file complaints, and that the heat safety plan needs to be available in accessible areas in multilingual formats. So that's one component. The other component is that there is just a very big gap in data around this, not only how people are interfacing off of a work site and whether they present in a medical emergency and it's tied to a work site. And so the health department, county administration, and several of our community partners are really trying to tackle this from a regional level. And that's part of the reason we're working to become better in touch with our Industrial Commission and our Arizona Department of Occupational Safety and Health to look at the types of complaints that are coming in from work sites. The other thing proactively that we've thought of, if we don't know if complaints are coming from a county work site, for example, that the Industrial Commission and ADOSH could be conduits to pass on the heat safety plan materials as they're investigating, because those materials are publicly available, and we, having the public health authority and working with national alignment standards. So we're working to kind of tackle that. It is a data gap, but we're trying to be as proactive as we can about it, and we'll continue to update you as that evolves.
Last question. So I understand that ADOSH has not adopted the recommendations from the task force members, even though a number of them, the majority, had requested that they adopt them formally. So I think that my understanding is that what that then means is that they are a set of suggestions that Arizona employers can choose to implement or not. So I would hope that we could call on ADOSH to begin the rulemaking process to ensure that there is true accountability, like defined measures in place, so that when employers fail to protect employees, it is sort of outlined what the process and the expectations are.
And if I may, Chair Allen, just a reminder, we're about 2 weeks away from needing all the materials in to develop our legislative agenda, working with CSA, and this would be a good item for us to put on that list. Thank you.
All right, noted. All I got. That's all I have. Yeah, thank you. Next on the agenda is item number 7. This is an update on county initiatives to address homelessness and public safety.
Thank you very much. And today we have, we're going to be talking about the detainee and crisis systems. Paula Pereira, the director, and others, and Dr. Jeffrey Alvarez, the medical director, and a couple of others from the team who I know Paula will introduce.
You can come on up.
You thought you'd get out of it? No.
We'll also welcome Deputy Director Linda Everett and Supervisor Keith Jeffrey to the table.
I will, here.
Good afternoon. I think most of you, not all of you, know who I am. I'm Paula Pereira. I'm the Director of Detainee and Crisis Systems. With me, I've brought Keith Jeffrey, who's the Program Manager of Invest, Dr. Jeffrey Alvarez, who's our Medical Director, and Linda Everett.
Madam Chair, could we have the speaker speak into the mic a little better?
And Linda Everett, who is
There we go.
the Deputy Director. She's over the detainee systems. So I guess we can just get started with the PowerPoint.
Can I just note
Yes.
one quick thing? It's just that
Yes.
we allocated 20 minutes for
Okay.
this and sort of thinking 10 minutes or so presentation and then Q&A.
Absolutely. So if we can start with the PowerPoint. Okay, so our department initiated a randomized control trial that was Invest. We started that program in 2021 with a DOJ grant of $1 million. And to date, we have served 1,370 people through the Invest program, and 70% of the people who've participated in Invest have also participated in freedom management. And we know that participation in freedom management dramatically increases somebody's likelihood of success and prevents them from recidivating and getting their life back on track. Because of the randomized control trial, we learned several things, that we had significant reduction in the number of jail bookings. People spent fewer days in jail than they otherwise would have. We increased the ability to utilize our participants' ability to utilize resources and build supportive relationships. And we were able to reduce our participants' stress levels around complying with their judicial criminal obligations. Based on those successes, the state attorney general awarded us an additional $2.6 million that we utilized to expand the number of people who could participate in Invest. We also expanded our jail-based release planning. One of the things that Invest really taught us is that there was no release planning in the jail until we had Invest. And so we were able to identify specific populations that could most benefit from those types of services. Our jail-based release planning is not as intensive as Invest, but we have expanded it, and we were able to identify priority populations. We also added staffing to our jail-based medication assisted treatment program. Next slide, please. The study that we had done that was funded by the AG grant, we also had independently evaluated by LaCroix and Milligan. And one of the focuses of the AG grant was a 30-day recidivism rate. So we found that people who were in our jail-based release planning that were low risk, meaning that they weren't, they didn't have as high a level of crime, that they were still felonies, but they weren't, they weren't murder. They were maybe auto theft or something, or a DUI. So we have a 2% recidivism rate with that population. We have a 3% recidivism rate for Invest, who is also a very high-risk population. And for high-risk jail-based release planning, we have a 4% recidivism rate on a 30-day basis. On your slide, you'll see a mention to the transition center and the control group baseline. I want to clarify for the board that those numbers are only people who are not, do have no domestic violence charges and who are misdemeanors. And so they're a different population than the population that we serve in the jail. Our population tends to be more severe, or, the bad hombres as opposed to, the guys who are shoplifting hot dogs. Important things that we should think about as we move forward is that most people in the jail have children. So when we are implementing these programs, it has a larger impact than just the individuals who are directly in the program. It also assists their families and their children. Most of the people we have learned have learning challenges. And specifically, those learning challenges tend to be around things like substance use disorder and what resources are available for them. Most people in the jail report having a mental health issue, but not having a provider at the time of their booking. Also, half the people in the jail report that they will be homeless or face housing insecurities when they are released. I know there's a lot of discussion about opioids and opioid funding, but methamphetamine is the highest reported substance used by detainees in the jail. It has been our observation that the existing community treatment system, so that outside of the jail, isn't well equipped for this type of population, people with criminal justice obligations, and who don't have transportation, who don't have secure housing, things like that. Our community system just assumes people have the ability to navigate complex systems, that they have the ability to transport themselves somewhere, they have a stable place to live. Our population really doesn't have any of those things. We've noticed that while resources are vital, without relationships, they are prone to misuse or abuse. And what I mean by that is that you probably have a primary care provider that you've had for a while, and you've developed a relationship with them. They're familiar with you and what your needs are. The way that our existing system works for this population, well, not just this population, but for a lot of our access population, is that when they go see the doctor, they see a new doctor every time they're going to the doctor. And so it's very difficult to establish those relationships and have your provider know who you are, what your needs are, and how best to address those needs. And I'll turn it over to Dr. Alvarez to talk about opioid. You have to push the button.
How's that now? Good. Madam Chair, the members of the board, the second part of this presentation was really to talk about overdose deaths in the community and what their justice involvement might have been prior to their death. What got me to look into this really was the data out there when you look up online are variable depending on the areas of that you live in the country, the amount, like proximity to the border, a lot of different things, but you'll see numbers that are huge. And it gets really confusing when you're trying to make decisions as a community, what to do about the overdose deaths if you don't know, well, what are our numbers? What do they mean? Upwards of 80% was some of the numbers I was seeing that people with justice involvement at any point in their life, and in up to 40% or so within the last year of their life before that overdose death. That's some of the numbers that you see across the country that were there that you could just publicly look and see. What I did was looked at just Pima County. So I got off the medical examiner's list of all the deaths in Pima County, not the ones for other counties that the medical examiners work off. I just looked at Pima County. Took all the opioid-related deaths, so that'd be fentanyl, heroin, methadone, any opioids, even prescription opioids, and made sure that I was comparing apples to apples with what the medical examiner was showing, and then looked every patient up from 2025 and 2026. So the numbers you're seeing right now on the board are the calendar year 2025. And looked in our medical record, which will give you a 5-year look back. So that's for their historical, like were they ever in jail? Were they in custody? And then also then go narrow that down a little bit more. Were they in custody a year before their death to match that 80%, 40%? What I found was really Pima County was half of that number. They're 40% ever and maybe 20% that within the last year. So it's a significant difference from those numbers that they're throwing around when you look up things online. And to me, that is something that really shows what you are already doing in Pima County by treating everyone in the jail, and you've been doing it for several years. That has, to me, says why you have that lower amount than what you're seeing in other communities maybe, or in those bigger numbers across the country. So when you look at the overall numbers, it's very small, especially if you think about the most critical, the people in the last 2 weeks before, like if they were in custody within 2 weeks of their death, that's the special population, right? The ones that you'll hear upwards of 24 times higher rate of overdose in a person leaving jail than a normal person in the community to overdose. Pima's County's numbers are very low. You can see that just going down that value, there was only 10% of them, 4%, that in the whole year of 2025. So out of the 265 deaths in 2025, only 10 of them were released from jail within 2 weeks. So when you're thinking about where is it best to focus on to improve overdose deaths in the community, honestly, the corrections part on my side is a small number than what it is for the community itself and people who are already out. Now, that doesn't mean that the inpatient stuff that we're doing while people are in jail, that's very important because that's the overall numbers are low because of that. But it tells me that where the focus is really now the community aspect. And what the director said, it's the methamphetamine use also. We don't have an answer for methamphetamine use. And a large portion of those in the medical examiner's report, public health reports, the reports that you see from us, we're seeing the same, that methamphetamine is a problem out there right now, more so, in all honesty, than the fentanyl, because we have answers to the fentanyl by giving people treatment and connecting them to treatment. The other is 2026. I took all the deaths also from the list for up to May. And then honestly, I think the slide goes through June. I was able to update that. So your memo has through May, but the presentation slide has, I got it like last minute. So I put those in there too. The percentages are exactly the same. So your numbers are running exactly the same for 26 as 25, 40% with a lifetime contact to the justice system and only 20% in the last year with only 4% within the 2 weeks at that optimum time.
Next slide, please. So some of the recommendations and a little bit of discussion. We want to, as a department, thank the board for your generosity in continuing to fund our MAP programs and as well as other programs that we have running in the jail. I think that to give you an idea of how large our program has grown since its implementation, as of today, we had 709 people on MAT services in the jail. That's 41% of today's population, jail population. To provide MAT services to that number of people requires bodies, nurses, providers. And through the board's vision and willingness to fund us, we've been able to expand our program to include 2 prescribing providers. We have 3 nurses Saturday and Sunday, 4 nurses Monday through Friday who are dedicated to the MAT Med Pass. So it's not including, people who need their insulin or their blood pressure medication. So it does take a great deal of staff to make it work. And our program just keeps getting bigger and bigger and bigger. So the other thing that I think it's important to note is that we need to focus more on release planning services in the jail. We need to try and expand that as much as we can. We're never going to be able to see everybody who goes into the jail because a lot of people get released within 24 hours or whatnot. And we just don't have the time to meet with them. But we would like to capture more people and at least offer them the services if we can. Currently, we have expanded through our contractor, NAFCare, our release planning services to 5 release planners plus a supervisor. And that has it's demonstrated itself to be very valuable. And we're able to capture a lot more people, offer a lot more assistance to many people. In fact, we internally have moved one of our vacant positions to our release planning arm, so that now we have 2 full-time employees that manage release planning and manage our contractors' release planning services to make sure that our contractor is providing those release planning services in a way that is beneficial to the county and meets the county's vision. We are also improving our coordination with probation, the court, and the public defender's office on how people are released from the jail and where they go upon that release, and trying to coordinate with them about what those defendants are going to need upon release and how we can manage transportation, set that up for them before they're released, manage their housing before they're released, manage their provider appointments before they're released. We actually schedule their appointments for them. We don't just refer them to go to La Frontera, they'll help you there. We say, no, on Thursday, whatever the date, this time, you're going to go meet with this person. We actually are trying to introduce the defendants to their outside provider before they're released so that they know who Paula Pereira is when they are released. That won't be the first time they see me when I arrive at the office. We do continue to reoffer treatment to those who initially refuse. Again, that's not always possible if somebody gets released before we have an opportunity to circle back. We are in the process of continuing, really, to identify barriers to continuation of care in the community. We are encouraging our community partners to expand immediate treatment access for patients releasing from the jail. That is really a big barrier for people, is getting that immediate access to care. Transportation is also a huge problem. As I mentioned, a lot of these people don't have their own transportation, so they get on the bus. The bus is a source of their dealers. That's where they can get drugs. So it's a lot easier to just get the drug than go to the MAT clinic. And we ask for your continued support of our programs that align with One Pima and the Prosperity Initiative, such as invest in the jail-based release planning. Do you have any questions?
Supervisor Kano.
Thank you, Chair Allen. Director, appreciate all of the information. This is now my second update as a supervisor on Invest. I had just joined as a new member of the board in your last report. First, I asked the county administrator to work with the director on any engagement that we need with the Attorney General's office to say thank you for this near $3 million investment. I'm reading between the lines that this grant has expired and we need to continue invest in another form. And I would love for us to hold hands with our staff to be able to both acknowledge how far we've come with the program and also knock on Phoenix's door for additional support. My question is related to the intersection between your program and the Transition Center and the Health Department, particularly on releases. Can you kind of give us an idea of how your systems are speaking with one another?
Sure. So the Transition Center services a completely different population. The population that the Transition Center serves are one misdemeanants who aren't booked into jail. They aren't housed in the jail. Many of them don't even step foot in the jail. So it would be a duplication of service for our release planners to refer somebody to the Transition Center because we've already done all of that work. We've already made all of the appointments. To send them then to the Transition Center would just confuse the message. So we don't necessarily communicate with the Transition Center on our release planning services. We have been in communication with the Health Department on some of their initiatives in relation to MAT services in the community and their interest in that area. My understanding is that that program has not been fully stood up yet, but I'm not privy, so I don't want to speak out of turn but that would be a potential area where we could refer individuals who are leaving the jail who are on MAT to the health department's clinic if and when that clinic is up and running.
And Madam Chair, one more question for the director, if that's okay. I am curious, so the funding for Invest has ended, but we still have the 2 additional positions that you mentioned that we added on the MAT positions. Are those county general fund dollars that are continuing that, or are they tied to the grant?
Chair Allen, Supervisor Kano, members of the board, those are all now general fund.
So I will, on Supervisor Scott, but just flagging that we've hit our 20 minutes. So as we go over, we're going to have to go under somewhere else.
Thank you, Chair Allen. Can we go back to the slide with your recommendations?
Chair Allen, Supervisor Scott, members of the board, there are 2 slides.
The last one. I apologize. The last one.
Yes.
There we go.
Is that the right one?
This is the one, yes.
Okay.
It just seems not only from the information on this slide, but also on a previous one, that the recurring issue of warm handoffs remains a real challenge for people after they are released into the community. So what is our plan other than encouraging community partners and identifying barriers? What is our plan to reach out to other actors within the community so that we can have an actual path forward in terms of not just emphasizing the importance of warm handoffs, but Pima County taking a leadership role in terms of encouraging those other partners what needs to be done. And if that is something, that's a pretty big question. If that's something where we need to get back to the board, I would welcome that. But I have been hearing about the issue of the struggle with warm handoffs since Dr. Garcia first gave me my introduction to the INVEST program. And would just like to know what we are doing to encourage, not just encourage, but tell other people in the community, other actors in the community, what needs to happen moving forward. Because I think we have the capacity and the credibility to offer a definitive plan.
Chair Allen, Supervisor Scott, members of the board, I mentioned that we hired a release planner that is a county employee, and we are adding another employee that's going to be also a county employee that manages release planning. Part of that position's job is to meet once a month with the health plans. So Arizona Complete, United, Banner. And she's developing relationships, not just with the health plans, but with all of the health homes, so that we have personal relationships
Great.
with them, so that we know them by name and we can call them up and say, hey, Jane, I've got Steve over here who has all kinds of issues. How can we work together? And so we are developing those relationships. It's very difficult for Pima County to tell a health home how to operate or tell a health plan how to operate, but we are doing our best to build those relationships so that they are responsive when we reach out.
Thank you very much. I appreciate that. I don't think, if that was mentioned earlier in your presentation, I missed it, but I didn't think that it was. When you were talking about the responsibilities of the release planners, so if I missed that, I apologize. I didn't think it was mentioned in that much detail earlier in your presentation, but I would certainly appreciate any updates. I think the entire board would in terms of the work of those two release planners.
Chair Allen, Supervisor Scott, members of the board, we are happy to provide you. We have a report that comes out once a month that I can add the supervisors to, that shows kind of a deep dive into what our release planners. We also have positions called corrections assisters, and they look at each detainee to determine what their insurance status is and to assist in getting that, if they don't have Medicaid or access, completing those applications on their behalf so that when they are released, their access will turn on. We have that broken down by plan, but how many people. I'm happy to send that to the board so that you can know that. And you are correct. I didn't go into that level of detail given our time constraints, and so I apologize if I glossed over.
No, you didn't gloss over. I think that that's the whole purpose of study sessions, is for us to try and drill down into some of the more details of all of the different presentations that we get during study sessions. I had just one other follow-up question, which is, when I was first introduced to the INVEST program, what most impressed me about it was its peer-based component. And just wanted to know if you had any additional information in terms of the successes or insights from some of the peer-based approaches that are part of the underpinning of the program.
Chair Allen, Supervisor Scott, members of the board, I don't know if you watched KOLD last night, but there was an interview of our INVEST staff as well as Dr. Alvarez, and one of the people who were interviewed is a gentleman by the name of Javier Arvizu. He is now a county employee. He works for INVEST. He was an INVEST participant. So he is a shining example of the success stories. We have many. I don't catalog them. I kind of feel like they're not show ponies to, the participants aren't there to, dangle and say, look what we did. Our mission has really just been to help them be their best versions of themselves. But we do have, in addition to Javi, we have other INVEST employees who are peers who have been system involved, have had addiction. We, in fact, just yesterday, in interviewing a release planner position that's going to be on the NAF care side of the house for the supervisor position, that individual is also a peer with lived experience and has justice system involvement as well. So we try at every turn to make sure that we are staffing with people who have been there and who can relate, and can also, frankly, see through some of the stories that our participants try and get away with, and call them out on it and say, you know, I see you, I've been there, I know that behavior, that's an avoidance behavior, and know exactly how to deal with it.
I can understand the need to not spotlight any particular individual. I was just more interested in terms of how the peer-based approach in general is still an underpinning of the program. That was more the focus of the question.
Appreciated.
Thank you. Thank you, Chair Allen.
We're over time, so I'm just going to toss out something I'd love to discuss more, and to just understand better, which is about the intersection between, well, first I should say, your recommendations are great. I really appreciate the clarity and the succinctness to them. I think they give us, kind of a to-do list of sorts to help support the expansion of the important work that you do. The thing that I was sort of thinking about with several of them is the intersection with the regional opioid settlement funds and that advisory committee. And so I think I would just, some other, maybe a memo or a follow-up meeting to understand a little bit if there has been some intersection with, I think, whether it's some of the RFP categories of the ROSAC funding, and if they have explicitly named people who are exiting the justice system, and whether or not, and this might be kind of going towards DCA Holmes, if that is an area of kind of education that might be useful for the ROSAC group, or folks are already thinking about how to uniquely cater some of the investments from the opioid settlement funds to be able to address the needs of folks coming out of the justice system. Because if there is a lack of programs, or if it is starting to get specified the need for transportation to MAT services or to residential programs, and ensuring that there's some good diversion programs as an alternative to going to jail. I think I just want to understand a little bit more of what that landscape is, and if there's more that can be done to utilize the opportunity that opioid settlement funds create, and if the committee has thought about that. So it's a long thing. Yeah.
Chair Allen, thank you. We have, just so you are aware, some of the programming in the jail, and specifically the MAP programming, has used opioid settlement dollars to fund it. But as always, we are here to answer any questions that ROSAC or the board may have, and to assist in any way that we can.
Thank you. Supervisor Hines.
Thank you, Chair. I think, and thank you for the information. Really good to see you all here. I would like to see a future study session where we dig deeper into how to improve community treatment system, excuse me, to better serve the justice-involved population. I think that should include, of course, at your recommendation, but I think, adult probation, the public defense services, legal defender, courts, detainee and crisis systems seems like a good one. Private sector partners also should be involved. I think that we could maybe make that another study session in a month or two, which would be
great.
Yeah, thank you.
Well, thank you all. Appreciate all of your work and the report. The next item on the agenda is number 8. This is the Prosperity Initiative Measuring Progress. And I will note that we dedicated 30 minutes to this. However, we are 10 minutes behind schedule. So we're going to have to, sort of adjust a little bit. Break schmake. Or do with Supervisor Hines. Well, hello. Director Sullivan, if you don't mind.
Chair Allen, members of the board, it's my great pleasure to introduce Dr. Helen Schaefer of the Community Workforce Development Prosperity Office of Economic Mobility. She's going to be giving us a presentation measuring the progress for the Prosperity Initiative. So with that, I'd like to turn it over to Dr. Schaefer.
Okay, thank you, Dan. And Chair Allen, Supervisors, County Administrator. Thank you for having us again here today, this month, to talk about the Prosperity Initiative. If I could get the slides pulled up. See here. So today, just to briefly recap, you'll recall that last month we were here talking about alignment, what alignment to Prosperity Initiative means, that it could consist of 4 different aims, broadly speaking, that we talked about how alignment may involve making sure that low-income families with children are prioritized, that they're served with effective programs and services, that those programs and services are streamlined, and that we include low-income families with children in our programmatic decision-making processes when we can. So we're focused in on that last point again, effectiveness. So how do we make sure that Prosperity Initiative is effective, and how do we assess progress both for the entire regional effort as well as at a programmatic scale? Next slide, please. And I want to frame this conversation in terms of a Prosperity Initiative policy cycle. So just to put this in very simple, basic terms, it's really the fundamentals of an evidence-based approach. We want to know what works, what to work on, do what works, and keep doing what's working. Easier said than done, but those are the basics. So next slide, please. We need to know what we're doing already in order to know what to work on. And we can because we have an inventory. The inventory is a catalog of programs and activities across the county organization. We update it annually. And right now we have just over 100 programs within this inventory. So quite a large scale, quite a few there. How do we work across that sort of scale? Well, what we have been coalescing around under the guidance and leadership of our Deputy County Administrator, Steve Holmes, over the past several months is a 3-tiered approach. So we are clustering programs into 3 tiers, 3 groups. In the first one are major investments and for major impact. So in this group, we have our efforts such as our regional housing work that the board has invested in, made a significant financial investment in that work. It's based on a community need that has been systematically assessed and understood. PEEPS is a similar type of program, our preschool scholarship program for low-income families. And so for those sorts of efforts, our role as a Prosperity Initiative has to do with evaluation, support, and planning. Our next category is the Align for Impact group. And all of this, I should say also is evolving. It's going to shift. This is by no means a set plan. It's something that we're in discussion about, and we do expect will change as we move forward and meet with departments and begin to roll this out. So Align for Impact, these are exciting, opportunities where we're seeing innovation. We are seeing work that does bring together more than one area to, as we've just heard about, regional flood control work, that is not only simply about water catchment and avoiding, the hazards of flooding, but also brings in a community engagement, other elements, environmental components, career, workforce development, and that sort of thing. Other sorts of programs within this category are excellent in some other way. For example, they have robust data collection capacity already happening. Invest, great example in terms of impact evaluation. So that's something we want to build upon and recognize, broadly speaking. So the plan here is to have a handful of programs that we work with more intensively to figure out together in partnership with the staff and the directors of those departments, how can we bring those efforts to that next level of impact? So it's going to be process of partnering with those departments to figure out together what that entails. With our remaining programs, the idea is really to introduce some resources which we already have available in some cases on our webpage. For example, evidence-based clearinghouses. So those are resources that can be utilized and by various different programs. It's just essentially a distillation of the research evidence in a particular area, giving guidance about possible interventions that have already been tested and shown to be effective. Next slide, please. And just a little bit more detail here about this plan and how it's structured in terms of the three tiers, and that how that's looking to us. And I think I covered that on the previous slide. But just again, this is something that we're working out now, and we do anticipate that we'll continue to evolve and change this and make improvements as we roll forward with it. On the next slides, we're going to be looking at measurement specifically. Next slide, please. So you will recall that one of the very first steps that we took after the board adopted this policy was to identify a set of impact indicators. And these are figures that are measuring how successful we are in achieving the long-term regional broad goal of reducing poverty and improving opportunity. So we have 31 total impact indicators. For each of the 13 policies has between 1 and 3 impact indicators. So we have baseline statistics for all of these, and we develop these numbers in collaboration with the city. So we share those, we're tracking the same stats, so we're aligned around that. Additional community partners were engaged in that process as well, and we used a systematic means of making the decisions. We had a rubric that we went through together to make those decisions. Okay, next slide, please. So in terms of how we link this to programmatic work, I'll get to that in just a second, but this is a dashboard that I'm excited to introduce that we believe will be ready to release as soon as next month to the public. And it is going to be an internet-based resource that is showing all of these impact indicator stats year over year. And so it is also showing trends, which is exciting. So there's a mapping of trends over time, and there's also an indication of whether we would like to see those numbers going up, going down, remaining stable. In other words, what good looks like is part of this dashboard. There's a mapping function on it, which goes down to the census tract level. So that's exciting. The dashboard itself has been put together in collaboration with our colleagues at the City of Tucson. So we're excited to have that available to showcase as well as a shared product that we've developed in collaboration with our friends at the city. So again, this is a place for measuring the overall impact for this generational change that's occurring as a result of a regional effort. So these are big long-term goals that we're measuring here, progress towards big long-term goals. Okay, so next slide, please. So on this slide, what we've done is to map out how a goal for the regional affordable housing plan is being achieved. And the key point on the diagram is that the measurement for effectiveness is occurring at a few different places. So we have, and this is actually taken from the regional affordable housing plan. So I didn't make these things up. They're part of the plan, and I've just mapped them out visually. So there are 3 strategies with 1 activity each, and those are being measured. In other words, the activities are being counted. For example, you see output measure, number of houses weatherized. And then you have a change measure, so the outcome measure, reduced monthly utilities costs, and then we have an impact measure, which is kind of collecting more than one thing together. So there's a lot of measurement here that's going on. The notable thing, that the takeaway here is not that there's a lot of different boxes. The takeaway really is that the entire approach is evidence-based. And so that's really what we're trying to move toward, broadly speaking, is to embed evidence-based thinking and approaches in decision-making. So the strategies that are, that were defined as part of this work were defined having an understanding of the goals that we're shooting towards. As you're aware, of course, that a regional affordable housing study was done to understand what the nature of the need looks like. So there's a systematic process that's in place here. And so this is a carefully planned, evidence-based major investment. Everything is not going to look, exactly like that across all categories. However, the thinking is a similar thinking process. So as we work with programs across the entire organization, we'll be thinking about these sorts of connections. Are the strategies appropriate for the goals? Is there measurement of outcomes taking place? Are we driving toward those sorts of long-term outcomes and measuring accordingly? That will be the things those will be some of the things that are on our minds as we're moving forward. And part of our role is going to be bridging gaps and building capacity to do more of this sort of thinking that's informed by best available evidence, which can come from multiple different sources. Next slide, please. Okay, so we have gone into some details in terms of measurement and research and that type of thing. But I wanted to bring us back in closing to something that's more tangible and big picture. So we're looking at a child who maybe we could imagine is born here in Pima County, is growing up here, and this child is born to a family and into a community that has abundant strengths, but few economic resources. And so we see that our policies are plotted along this line and this timeline, and we can see how they intersect with this child's life. And I think that when we do that, it can be informative in terms of figuring out together as a regional collective, where are possible avenues, where are gaps? Where are opportunities that we can build upon as we're looking at this trajectory through time and through someone's life? Where can we bolster our efforts? So we know that education, for example, is key. We know that education and training needs to be preparation for jobs that can sustain a family. So the jobs need to be accessible and available here for that to happen. And the entire time span matters, clearly, but I think it can be useful to think about where we are working as a collective along this line. So are there places where people are falling through the cracks or are particularly vulnerable, or are there windows of opportunity where we can build additional efforts? Are there places just in the developmental process where we're concentrating more effort and, do we need to revisit perhaps where we can fill in some gaps or build bridges with other entities? So, as a community in partnership with others, how do we do this? And so I think this is something that, again, it's a big picture kind of a thing, but just to kind of frame up perhaps for additional conversations that can take place here or in the future. So with that, thank you again, and be glad to take any questions you have.
Thank you. Any questions from my colleagues? Okay, I have questions. I'm surprised. So I appreciate the and I understand that it's tentative, but the sort of clustering into the MIMI, the AFI, and then the sort of general, I forget what the last category, see it, need it, acute. general alignment, those three categories. What does the process look like for, assuming you keep it in that sort of structure, what's the process look like to kind of identify what is in the MIMI, what is in the AFI? And I do understand sort of the general alignment and the work that's been done to date. So maybe just those first two.
Yes. Chair Allen, thank you for that. So the main criteria right at the moment is the potential for impact that we're seeing. So we have there's a strong and, we have a clarity, I think, about with the major investments for major impact, that there will be major impact from those major investments. So there's a clear trajectory there. With the AFI programs, it's more exploratory because we are seeing some positive elements. We're seeing some opportunities to, continue great work and build upon what's already happening. So that's the main distinction between those two. And it's really going to be, I think, we have one of our first steps here is going to be to refine that list for the AFI group, because we have so many that we are looking at the moment. So with the major investments for major impact, it's a smaller set. And then we have we have a general category, which is a pretty large group, but we just still have too many in our AFI group. So we have to really actually get together internally, have a discussion about refining that list and figuring out what's manageable to accomplish. And then we'll distill down to a smaller group for the work ahead, for the actual intensive meetings. And I think we, of course, would want to have some preliminary meetings with departments before we just kind of launch into that.
And then my last point is, maybe it's more of a point, but something that we need to kind of just, I think, discuss more, right, is that the next meeting of the joint city and county is in August, some mid-August, we'll say. August 13th, and I believe that the focus is going to be on the Prosperity Initiative and sort of how the city of Tucson and Pima County can work together to both take that we are both doing significant work. There is overlap and coordination, but how can we do it better? What are the ways in which we can collaborate together more effectively, or what are those gaps? So I guess I would love to hear from you all about suggestions, and from my colleagues too, of like how can we make that discussion as rich and meaningful as possible. So it's we could do a survey or something.
Chair Allen, thank you for that. That's a big question. I think that's kind of where I was I think is where I might be inclined to make a suggestion for consideration, because often we're we want to begin where we are, which makes sense, but where do we need to go? So what are the needs in the community that we're seeing, and then it's kind of if we need to kind of move into those. So that's kind of how I think a needs sort of assessment approach would make sense.
Chair Allen.
Supervisor Scott?
I think specific to the joint meeting with our colleagues from the city of Tucson, if the board could get fairly early on either a draft agenda or a draft list of topics, that would be helpful in terms of providing you with the input that you're seeking.
Mm-hmm. Great.
And if both bodies could get the same thing, then
that sounds useful. Okay, great. Well, thank you.
Thank you.
So we are moving on to item number 9, which is our monthly financial update. We are back on time We have about 10 minutes, which is what we had allocated for this conversation.
Good, thank you.
Thank you, Chair Allen, members of the board. Today's financial presentation is going to be a little different in terms of the presentation. We're going to focus on the work that we've been doing in the grants area. Next slide, please. So the first page here is an overview, just to give you a high-level overview to the board of the Finance Grants Division within the Finance Department. We're structured around 27 employees in our Finance Grants Division. That's a division manager. We have 4 accounting supervisors and 22 accountants, ranging from accountant 2s to accountant 3s. And I want to pause here to thank the board. During the budget adoption, we were allocated 3 PCNs to continue the work that we do in the finance grants area, so really appreciate that support. We're responsible for all fiscal management in the grant lifecycle, so that would include budgeting, reconciliations, billings, reporting to the funder, receivables, managing the expenses, as well as the CFA reporting, which you all are fully aware of. Our current grant portfolio, just to give you an overview, we have 330 active grants totaling $525 million in total awards, with about 250 of those being federal in nature, with $490 million in funding from the federal level. So the importance of that CFA is highlighted within that number. As the board will recall, we transitioned from the Finance Grants Division transitioned from Grants Management and Innovation back in March of 2025 into Finance. Next slide, please. So as we looked at during the transition, we focused on really 4 areas that we identified for key improvements, and that one is staffing. In terms of retention and recruitment, we had a high vacancy rate of about 21%, which peaked at 38% late in 2025. We had 24 authorized PCNs, and we had a workforce turnover issue. Of those 24 PCNs that we had when we transitioned, only 9 remain today, which highlights the turnover that we've had in that area. We also focused on training and technical knowledge. As you can probably imagine, the turnover and vacancy created a void in our training and our technical knowledge, so we focused on that area. We also focused on 2 key areas which were highlighted in the CFA as areas for improvement, which are the development of policies and procedures, as well as documenting our processes and improving in our technical resources. Next slide, please. So what have we done and how have we done it, and have we made progress in the attainment of those focus areas? The answer is a resounding yes. So we've strengthened our recruitment process. We have implemented standardized accounting exams for our accountants as we've onboarded them and gone through the recruitment process. We have a thorough review and alignment of our interview questions to ensure that we're bringing on the candidates with appropriate knowledge and expertise in grant compliance and accounting. And we've also leveraged our tenured subject matter experts in our financial control and reporting and revenue management areas. And so I'm happy to report, as of June 30, we're down to 1 vacancy in the finance grants area. As I mentioned on the prior slide, we've been working really hard to develop our internal standard operating procedures, job aids, and administrative procedures, specifically to address the CFA finding in 2024 and 25 that dealt with the lack of internal policies and procedures. And so we're happy to report that AP 2286 is out for its reporting period right now, and we expect that to come back here very shortly. We also focused on providing a myriad of trainings to our staff. We brought in an external consultant who gave governmental accounting 101 training. We did single audit training so that our team is fully aware of the timelines and the deadlines and the work that's to be done surrounding the single audit. And I think we've increased staff morale as a result of that. So that's been really positive from the staff perspective. We've worked together with our other divisions within the department. So finance grants worked closely with our FC&R division and the revenue management division during the FY25 audit, which really solidified our staff understanding of the process and helped them cross-train staff. So that was another key area that we were very proud of during the last CFA cycle. And finally, a few months ago, the board authorized the implementation of the Workday Grants module. This wasn't included originally in the Workday ERP ecosystem for the county, but we have done some additional research, and obviously the board authorized that. And so what that's going to do is help us streamline some of the manual processes around our integration work and standardize our internal controls and enhance our reporting for the CFA. So we're really proud of the work that we've done, and that concludes my brief presentation. I think I'm inside the 10 minutes. I'd be happy to answer any questions the board may have.
Thank you. Any questions? No? All right. Well, thank you as always for your presentation. And that brings us to study session agenda item 10, which is adjournment. So I will move to adjourn the study. Oh, I don't even have to move. We just gonna adjourn it. And we will come back at 5 o'clock.